This works much better in the evening when we've got a great internet connection and there's no other staff here at the association kind of using up our internet bandwidth there. Wanted to introduce briefly myself. Again, I'm the Senior Director of Student and New Practitioner Development at APhA. And then also joining us today is Latoya Wilson. Latoya is the APhA Manager of Membership and Chapter Services within the association. Just wanted to remind everybody quickly, Monday night we had our New Practitioner Mentor webinar. Tuesday we had our Finance Vice Presidents as well as Policy Vice Presidents. Tonight we'll have our Communications and Membership Vice Presidents webinars. And tomorrow evening, which is our final night of webinar week, we will have our Patient Care as well as our International Vice Presidents. If your students haven't signed up already, I highly encourage you to send a quick email to them, letting them know that these are happening. They last about an hour, as well as this webinar will today. We try to go about 45 minutes and then allow some time for Q&A. Today's agenda, we're going to spend some time going through the fall membership drive, as well as reviewing the process for chapter advisors and what you need to do to log in for pharmacist.com. I'd like to then spend some time discussing the essentials for a successful chapter, and then provide you with some updates from headquarters, and then go into some Q&A this afternoon. So I'd like to launch our first poll question. If everybody wouldn't mind, the poll function, and actually if you have any questions or comments, you can use in your right-hand toolbar there within GoToMeeting. We have the opportunity to do questions. Please write those in as we go along. We'll try to answer those as best as possible for you. But then also we've got a chat function, so you can chat with other attendees as well as the presenter. But let me pop open the first poll here. It is, how many years have you served as chapter advisor? And on the call today, it looks like we've got about 16 advisors with 2 staff members there. So about 75% of you have voted. I'll give it another 5 seconds. All right, we're going to close the polling there and then share the results. So it looks like about 50% of you are within your first 3 years, 33% of the attendees, so about 5 or so there, are within your 0 to first year, and then we've got a couple that are within 10 years or more. So we do appreciate you guys jumping on the webinar today. So our next polling question is have you logged into your chapter administrator account? And that's the account that you have on the back end of pharmacist.com. So the answers are yes, no, and for those of you who do not know what that is, we'll actually go through that. But we wanted to get a quick poll to see where everybody was, and we'll open that up there. All right, it looks about 75% have voted. Keep it open for another 5 seconds. All right, we're going to close that poll there. So the results are about 38% have, 54% of those on the call tonight, so about 9 people haven't gone into that, and about 8% don't know. So it's a good thing that we have Latoya here today to kind of walk through that process with you. So the last thing is just a follow-up question to that first one is have you passed on the chapter administrator account information to your chapter leaders? And a good leader would be either your chapter president or your chapter membership vice president, which we'll talk a little bit about there. And just want to figure that out from you guys. We'll launch that poll there. All right, looks about like half of you all have voted. Leave it open for another 5 seconds. And we'll close the poll there. So the results here, about half of you said yes, you have, the other half no, and that 8%, which is the same number before, is kind of in that I don't know section there, probably for some of our new leaders. So I'm going to turn over the webinar to Latoya Wilson. Latoya, would you mind giving a quick overview of yourself, and then kind of jump into the webinar there?
Hello, my name is Latoya Wilson, and like he said, I'm the manager of membership and chapter services. And my job is basically to assist the membership vice presidents as well as the chapter advisors with anything that they may need for student drives or information on their accounts. And so first I wanted to start to discuss the chapter administrator account. Keith started with a couple of questions about the account. And for those who have not had a chance to access the account, what the chapter administrator account is, it's a profile of your chapter that contains all of the information your students need for their drives, as well as information that you and your students need to update any information about your chapter. On your chapter accounts, you can pull reports, and you can also designate chapter committee members. If you have not designated a chapter administrator, I would recommend that you do. I know that advisors can get busy from time to time, so if you designate a chapter administrator, your leaders will have an opportunity to log into your chapter profile and do some of the things that you may not have time to log into your account to do. So I'm going to move on to the next slide. Okay, so how you access your chapter administrator account is you want to go to pharmacist.com and log in as if you were logging into your personal account, but your login credentials will be a little different for your chapter administrator account. You would log in using the username and password that has been emailed to you, and I just want to let you know that if you don't have access to this information or if you have not received this information, you can contact me after the presentation and I'll give you your login information so that you have an opportunity to access your account. So once you're logged into your account, it'll tell you in the upper right-hand corner, it'll tell you your school's name because it'll say welcome back, and it'll have your school's name and the administrator. So what you want to do to access your account is just click on the My Account option under the welcome back with your school name. So once in your chapter administrator account, you'll be able to see all of your school's contact information, your school number, the email address that we have on the account for your school. So you will select the My Groups option, and the My Groups option is the page that you'll go to that'll show where you can run your reports as well as add executive committee members. So here is the page that I was previously discussing. So the View Reports option will be at the bottom of the page and the Add Committee Members. So here on the Reports page, there is a key at the bottom of the page that describes each report that is available to you. You have your chapter rosters, your reimbursement reports, and they also show the period of each report. So when you receive the check or the electronic transfer into your bank account, you'll be able to reconcile all of the payments through the reports available to you here. You also have a report that shows the new members into your chapter, and a great report that shows your non-renewed and expired members. This report is great for the fall drive because your membership vice presidents will be able to see who has been renewing through your chapter and who they need to reach out to encourage them to renew their memberships. You also have monthly transaction totals so that you'll be able to see how much money your chapter has been bringing in through the fall drive, and then you'll also be able to see the number of transactions that your chapter has been occurring through the drive. And there's also a report that shows your yearly dues totals as well. The state reports are also down here. They show what the states have access to. They'll be able to pull these reports to see how many students from your chapter has joined their association if your chapter is connected to a state association. So here's an example of the membership roster. It has all of the students' information. It has the address, email address, the personified ID, and the member type, as well as the expiration date. Here is an example of the chapter reimbursement reports where it has the name of the student, their member ID number, the date that they pay for their membership, as well as the amount and their contact information. Here's a quick example of what the revenue reports look like. So at the top, you'll see how many students have joined your chapter through each month. You'll also see how much money your chapter has collected from those students joining each month. And then you also have a year-to-date total report at the bottom. So now I'm going to switch back over to Keith so he can talk about the recommended chapter leadership structure.
Thank you, LaToya. I appreciate that. So part of the process of making sure that we have good communication with all of the chapters, we actually put forth a recommended core positions. We did that about 3 years ago. Now these have become more of the standard positions that we look for within each of the APhA-ASP chapters. So that would start out with your chapter president, president-elect, MVP, your finance vice president, patient care, policy, communications, international, and then chapter advisor. And so your chapter president is the individual who runs the executive committee. They serve as a liaison to the PY1, 2, 3, and 4 classes, kind of interacting with those liaisons to make sure that they have got a good reporting structure back and forth, and so that you get your messaging out to each of those classes. We look for that president-elect position to be the student pharmacist who not only shadows the president throughout the year, but they're the one who is recording all of the statistical information questionnaires that we have at the end of each of the patient care projects, as well as all of the projects and programs that you're conducting throughout the year. We like the president-elect to do that because as they learn about their position and they learn about the chapter and how it works, they collect all that data and all that information so that they're able at the end of the year to put together a fully complete chapter achievement award report. So if you start your time frame in April, you do that shadowing, you start those records early enough, when you get to that June, July time frame when those reports are due, it's kind of easy to put that together. Your MVP, we see that as the person who not only runs the fall and the spring membership drives, but they're also the person who's going to make sure that all of the chapters know about the membership benefits that APhA provides. We also see this person as running the social events, the back-to-school picnics, any of these social evening events that we have. We've got a lot of schools that do charity balls, that sort of thing. But we also look for the MVP to be in charge of the professional affairs kind of events and be chair of those. Finance president, finance vice president is your treasurer. It's the typical position to not only run what goes in and out of the bank account, but this person's in charge of the taxes that need to be filed each year in May. But they're also the head of the fundraising. It doesn't have to be that person's position. If they want to, have a fundraising chair or committee under them, we highly recommend that. But that kind of fits in with the whole money there. Plus, a lot of chapters do some meeting travel, so we kind of see the annual meeting and MRM, the hotels, as well as how you're getting back and forth. We see that kind of falling underneath that FVP position. Patient care vice president, it's kind of self-explanatory, but Generation RX, diabetes, heart, immunization, and our new project, OTC literacy, which I'll talk a little bit about later. The policy vice president makes sure that each of the chairs and the committees for these patient care projects have the information that they need in order to go out and run an effective program within their local community. So the policy vice president doesn't have to run or be at every single event, but they're going to make sure that if you're communicating with your local school district or your elementary school, that each of the patient care projects knows when it's happening. They know what they need to do in order to go into that event, what kind of CLIA waivers they need, what type of insurance you need in order to go to your state fair or to your local mall. So it's a lot of the background logistics, but it's vital that all of those things get taken care of. And because you have to do it for all the patient care projects, it's easier for one person to take care of that, and they then report back and forth. And the policy vice president, position which we've had for quite a few years there, we see that as the person who's the guru on your campus to run your policy events, but also kind of running your state association legislative days, as well as serving as your chapter delegate. Now, the communications vice president, secretary, social media, website, public relations historian, all of those are phenomenal positions, and obviously this can't be run by one person. So we see communications vice president as one of the most important positions on the executive committee. They're the person who's going to maintain everything that happens from top to bottom and making sure that your chapter is running effectively. We also see the communications vice president being that liaison to your school, college, pharmacy, or even your university to make sure that you're following the proper rules and procedures in order to reach out to the local media, to local radio, to make sure that you're interacting well with the president's office or the chancellor's office within the university. So that's a big job, and we want to make sure that they have the information they need. So I encourage you don't have a CVP, make sure that you sign up for one of those, and we've got the webinar, as I mentioned earlier tonight. International works with APhA-ASP, pretty self-explanatory. We've had that position for many years, and then obviously you as a chapter advisor. So we know that you have a lot of other committee positions, but within our database, we only allow for you to enter in those president, president-elect, and all those vice president positions. But if you have some of those other chairs and you want them to receive the general information that we do send out on a monthly basis, you can definitely sign up and have that person listed as a chapter executive committee member. Whereas the other positions only allow for you to submit one person's name and contact information, you can have multiple of the chapter executive committee member positions there. And I just wanted to throw in, before I turn it back over to LaToya, throw in a big pitch for New Practitioner Mentor. Right now we've got about 90 mentors nationally, and I'd love to have all 134 schools and colleges of pharmacy have a New Practitioner Mentor, if not multiple mentors. The job of a chapter advisor is extensive, and we really see this as an extension of you to help out the students when it comes to mentorship, to be that person to go on site to help out during your patient care projects, to serve as that preceptor during several of your events, to work with them on career opportunities, to come in and talk a little bit about what they've done from a residency or post-grad experience. So I highly, highly encourage you to get a New Practitioner Mentor. And if you do need information or just don't know where to go, Tom English is our director of the New Practitioner Program here at APHA, and his email address is there. Just give him a quick email. He'll respond back within a couple days, and hopefully we can get you guys set up. So turning it back and really focusing on membership, which is LaToya's area, we wanted to launch another quick poll. We just want to see real quickly, hopefully everybody knows what an MVP is, but we want to know, does your chapter have a membership vice president? So we'll throw that one up there as your poll. About 70–80% of you have voted already. I'll leave it open for another 5 minutes or 5 seconds. All right, and we're going to close that poll. So interesting enough, we've got 79% that said yes, and then 21% said they don't know if they have a chapter membership vice president. So hopefully it's all those newbie chapter advisors that need a little bit more information that's there. So, all right, I'm going to turn it back over to LaToya. She's going to go over how to add those chapter positions that I just talked about into the database so APHA has that information.
Okay, so first I just wanted to say that if you do not know whether you have a membership vice president, it's recommended that you log on to your chapter administrator account, because as you see on this page, there's a key that shows each position that you have listed for your chapter. So if you do have a membership vice president, it will show up on the key on the Add Committee Member page. So once you're logged into your administrator account and you select the Add Committee Member option, you'll be redirected to the new committee member search page. All you have to do is just click the search option, and it will pull up everyone in your chapter, and you'll be able to select the people that you want to add to the positions. And here's an example of the list that will show up at the bottom of the page. You just bubble in the option of the person that you would like to add to the position. And here is all the information that is required about the position that you're adding. So the from date and the to date is 1 year apart, and all the positions end on April 31st of 2016 once you add the positions in. So here you'll know for sure whether everything was entered in correctly, because you'll be able to see a list of all the positions that you added.
So we're going to kind of stop there real quick and see if anybody has any questions about adding in your chapter positions, or if you just have any questions in general, kind of the process that we just went through. In order to ask questions, you have the opportunity to go through the questions function over on the right-hand side. You can type your question in, or if you'd like to, you can click the raise hand function. And what we'll do is we'll click on your name, we'll unmute you, and then you can ask your question live. So we'll leave that open for about 10 seconds here if you'd like to add something in. If not, we'll continue with the presentation, and you can ask your questions, and we can focus on some of those at the end of the presentation. All right, it looks like no one is putting any questions in right now, so we'll continue. We'll kind of move on forward. LaToya will go through the process right now of talking about chapter goals.
So this summer at Student Leadership Institute, it looks like 109 schools submitted goals for their chapters. And so the importance of goals is that we ask the students to set goals to give them momentum to recruit students from their chapters. The chapter performance overview or the trend sheets were uploaded to your chapter administrator account, and what these sheets showed was a trend of the membership numbers over the years for your chapter, as well as chapter goal sheets were uploaded to your chapter administrator account. So your chapter administrator account is very important because it has a lot of important information on there. So if you have any questions about goal setting, if you're unsure if your school has set goals, please contact me and I can help you through that process. Through the fall drive, we'll be having a few status report updates sent out so that we can track the numbers during the drive, and you'll be able to know how well your school is doing also during the membership drive. So now I wanted to move on to talk about the fall membership drive. The membership boxes were mailed out on August the 4th. So if you have not received your box yet, or if you have received your box, please give it to your membership vice president as quickly as possible, because it is important for them to have, because it has all of the information in there that they need to run their drives, as well as important information on recruitment. In your fall membership box, you have enrollment forms, you have posters, and you also have the Chapter Advisor Survival Guide. And in this guide, it has all the information that you need about your position and also how you can assist your membership vice presidents through the fall and spring membership drive. We have kind of did an overhaul of all the materials in the box. Right now we have the APhA Membership Advantage campaign going on, and so a lot of the materials look different. The posters have been revised, a lot of the booklets have been revised, so be sure to take a look at some of the new materials in the box. We also want to encourage online enrollment. Even though we have blank membership forms in the box, we really want the students to enroll online. Their memberships are active immediately when they enroll online, and they'll have immediate access to the benefits of membership if they enroll online. Any other process, it takes a little longer to get the students enrolled, so we really, really want you to encourage them to use the online enrollment process. So here, I want to discuss the APhA-ASP Leadership Portal. So as you see, the URL for the website is listed here. On this page, you have all of the materials that is included in the fall drive box, as well as a digital booklet of your Chapter Advisor Survival Guide and your Membership Vice President Toolkit. If you're not sure whether you have a membership vice president or you have one that has not been entered into the system, they will miss out on some of the communication. So if you're late entering this information, you can always lead them to the portion of this website once you have them entered, and they'll be able to access all the information that they need for the drive. On this page, you also have membership development plans and suggested activities for your chapter. You have all of the forms, such as the membership enrollment forms and different promotional items for your chapters and students during the drive. And you also have videos and other marketing materials. So when you get a chance, please be sure to go check out this page and look through some of the great information that we offer. Now I want to discuss the NAPLEX benefits for the 2016 graduates. I know this is an important benefit for a lot of the final year students. So 2016 grads, when they join APhA during the fall drive, they'll get a free copy of the APhA Complete Review for Pharmacy 11th edition. Although this edition will not be updated, the Chapter 10 Drug Information chapter will be updated digitally, and they will have access to this once they purchase the book. There will be no shipping fees for dual members, although there is a $10 value. Final year members will have to pay the $10 shipping fee if they decide not to choose the dual membership option. Students who choose the dual membership option, for 2016 grads who choose the dual membership option, will also have access to the NAPLEX review questions section on Pharmacy Library. They get additional questions, and for dual members, they get 200 additional study questions, and final year students get 100 additional study questions. Dual year members receive a 19% discount. So the discount comes because they couple the final year membership with the first year pharmacy membership. And when you couple it together, it comes out to a 19% discount. So we always encourage chapters to get their final year students to sign up as a dual member because of all the benefits that are offered. And they also are able to easily transition over into their first year pharmacist membership. So you want to encourage your membership vice presidents to let their final year students know that it is very important for them to get their final year students into this dual membership. For NAPLEX benefits, the students must be enrolled by October 31st. There are a few deadlines that I discussed at the beginning. There's a deadline of October 31st for these benefits. There are a few deadlines that we'll discuss later in the presentation where I'll be able to tell you when the NAPLEX benefits are available, as well as when some of the rebates and reimbursements will be available for your students. So here I just want to quickly discuss your chapter reimbursements and rebates. It is important, if you have not enrolled into the electronic transfers process, to update your work address on pharmacist.com, because your checks for your chapter reimbursements will be sent directly to your work address. The chapter reimbursements is if your chapter has opted for us to collect your chapter dues, we'll send them 5 reimbursements annually. Here you see that the reimbursements are sent by the end of the month. The first one was sent out in June for January through May enrollments. The second one is sent out in October for June through September enrollments. In November, October enrollments are sent, and December, November enrollment reimbursements are sent, and in January, December reimbursements are sent. Also, chapter rebates are your chapter for each person that they enroll by October 15th will receive a $3 rebate for each student that they enroll. And if they enroll students after this deadline, they have up until November 8th, and they'll receive $1 rebate for each student that they will enroll. So now I'm going to pass it back over to Keith for the poll question.
Sure. So before we kind of jump back into the poll question here, we talked about a lot of different things. So we talked about the dual membership program where final year students can pay for not only their final year as a member of APhA-ASP, but they also pay in advance for their first year as a new practitioner. We talked a little bit about how to enroll your student pharmacists to make sure that your executive committee leaders have all the resources and information that they need. We talked about the NAPLEX review book and some of the deadlines that are available for that. So if you do have some questions, we'd love to answer them for you now related to membership, because I'm going to kind of jump over to some chapter operations issues. Our first question is from Bob Chapman from Midwestern. He asked, will students who became dual members last year who are now in their final year also will be eligible for NAPLEX benefits? So will students who became dual members last year who are now in their final year also be eligible for NAPLEX benefits? And the answer is yes. Any students who signed up in the spring drive during that April portion there, they automatically sign up for that. And the reason why we have a spring drive is we want to hit the students when they're physically at school, and this is for your traditional four-year programs where at the end of your third year, which usually ends for most schools around that April-May timeframe, the students are gearing up to ready to go on rotation. So what we do is we do a presentation for them. It's usually the new practitioner mentor that does it. We talk about what life is like on rotations, what's life like over the summer and the fall as you kind of prepare your CV to go to ASHP's mid-year clinical meeting to apply for residencies. We talk about what it's like to go out and actually have to travel to go to postgraduate or residency programs to go do the interview process. So through that, we try to get that and try to hit them before they leave campus. But we also have them sign up in advance for membership. So in essence, you're paying in April, but your membership for your final year doesn't start until November 1st. So you're paying a little bit in advance for that. And if you sign up as a dual member, you're not only paying for your final year, but you're paying for your first year as a new practitioner. And as LaToya mentioned, it's a 19% discount, which is pretty significant. And you do receive that there. So thanks, Bob, for that question. We appreciate it. If you have any other questions related to any of the membership issues that we had earlier, please, 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 we want to make sure you have as much information as possible, especially for that percentage there that this is your first year, 0 to 1 year, as an advisor. There's so much to learn, and we really want to be your resources and your guide to help you through that process because, frankly, I'm confused a lot of the time, so I'm sure you guys are as well. We're going to launch another poll question here, so ask those questions, but we'll get started with this. The poll question is the issue that I'm struggling most with as a chapter advisor is, and the first one is my chapter president or chapter leaders balancing advising with other job responsibilities, something related to P.com or the membership campaign, lack of support from my school or college of pharmacy administration, or other. And it looks like about half of you have voted already. And I'll leave it open for another 5 seconds. And we'll close it. All right, so kind of as I suspected, 85% of you on the call said that balancing APhA-ASP advising with other job responsibilities is the most pressing issue that you're having right now, with a follow-up of my chapter president leaders and then some other. So for all the newbies that are out there, there is some light at the end of the tunnel. We do try to provide as much resources, information as we can here at APhA, but we've also enhanced some of the information that we've provided to the students through our Summer Leadership Institute, as well as our mid-year regional meetings, and as I said earlier, the webinars. So hopefully we can take some of that burden off of you by better training your chapter executive committee leaders. But as you can see the wordle here, there's a lot to happen, and a lot of times we feel like being a chapter advisor is really another full-time job. But in order to kind of help mitigate a lot of those responsibilities and all the dates, deadlines, and things that kind of mesh up against everything you're trying to work on, whether it be starting a new practice site, meeting the needs of your department chair, or just having to teach in general, we really feel that the best way to do that is conduct your officer retreats. And if you're to make, a minimum of 3 meetings a year for your executive committee or for your overall membership, I'd highly encourage you to make sure that you meet and participate in chapter officer retreats. Our suggestion is that you have one in the springtime, so right at the end of the second semester in the traditional schools, one before summer, so August. Hopefully you've either had it, or if the students are coming back next week, you're having it within the next week or two, and then one in December, January. So that spring or that May planning is kind of the incoming and the outgoing officer session, where the newbies kind of meet with some of those students who have already been in their positions for about a year. That's when your budget planning process starts as well. So any ideas for new projects or programs or things that need to be handed over, that kind of happens in that spring retreat. So we have the old folks talk about what worked and what didn't work, and then the newbies kind of set the agenda and what they want to get accomplished over the summer. Now, the summer is where planning happens. So all the outreach to your community partners, whether it be local school districts, the mall, state fairs, I kind of mentioned earlier, all that planning kind of has to happen in the months of July and August so that you're ready to go when the students come back to school, which is in the next couple weeks. So we've already had our Summer Leadership Institute. We've had a couple webinars now. Now the students kind of know what to go, where to do. Now it's putting things into the calendar. So hopefully by now, all of your classes have been scheduled. You're able to see when and where labs are, when rotations are for those IPPEs. So now you can kind of fit in where your general meetings as well as some of your patient care projects are going to be. And that's really what the August retreat comes down to, is that planning. What's the fall semester look like? Who's going to come and speak to our students? How are we going to get things done in a timely manner? How are we going to follow up with each other? That all happens in summer. And then the winter retreat is an assessment of what happened in the fall and then planning for the second semester. So as you start into January, February time period, you've got a lot of back-to-school type things. You've got annual meeting to plan for. You've got all of your winter events, whether it be Heart Month or some of the policy-related events that we do in January. And then you've got that time frame when you need to do your elections. And we really recommend that you guys have your elections in that late January, early February time period so that you can have a student not start their position in February, but what they do is they're elected and then they'll shadow that existing officer there for February, March, and April, and then they officially take that position over at the end of April. What that also does is when we have our annual meeting this year in Baltimore, which is at the beginning of March, the new students who are recently elected can then come to the workshops at annual meeting for each of those core positions. So your MVP, you don't want to send your outgoing MVP because they've already gone through the process. You want to send your new one who will know what to do during the spring and fall membership drives there. Something other I want to kind of pitch is our student outreach visits. We've had about 45 of the 60 schools that are eligible kind of contact us. So tomorrow is actually the time when Candace and I are going to sit down and map out the rest of the outreach visits. So if you're on the phone and you feel like you need a visit, you might not be eligible, please send me an email afterwards. We'd love to visit your school. But we try to do these every third year. Now, obviously, with 134 schools and colleges of pharmacy and only about 5 or 6 of us doing visits, it does make it difficult, but we try to go every third year there. The new schools and colleges of pharmacy, we visit at least once or twice every within the first couple years there. And then the same thing is with satellite campuses. We try to kind of go back and forth between the main and satellite campus. But unfortunately, we've kind of had to cut back. So if we are, say, visiting Idaho State University, we're only going to go to either Pocatello or Boise. We're not going to go to both in the same route. It's the expectation that you have video conferencing technology and that you're able to kind of have our visitor meet with the other group or meet with the other executive committee via VTC. And then we also try to save a little bit of money via some travel loops. So if we're going to the Chicago area to visit Bob Chapman at Midwestern, then we'd love to stop at UIC or some of the other schools like Rosalind Franklin or Roseman, Roosevelt, excuse me. So a quick overview of the schedule. These are core things that we have to have. General meeting with the chapter in general. We'd love to present our student outreach presentation. We also use this as a membership driver, a catalyst to get students really excited about APhA-ASP. We'd love to have breakfast in the morning with chapter president to kind of get the temperature of the culture at the School or College of Pharmacy as what kind of things are happening good or bad with the relationship between the students and the administration, with the advisor, that sort of thing. We'd love to then get the other side of the story from the advisor, so we'd love to do that right after breakfast. And then anytime during the day, if we have the opportunity to meet with the executive committee, your dean, student affairs office, and any students or faculty members that we have. So we use this as not only an opportunity to kind of focus on the membership, but then we also get feedback in your programs. And we love exchanging ideas with other schools and colleges of pharmacy. You'd be surprised how many innovative ideas we found through outreach that we're then able to kind of share with other schools and colleges of pharmacy. So Candace Aller, who is one of our new staff members within the Student Development Department, she is actually the one who you're going to want to email. You can email me as well. But we'd love to get you signed up for a student outreach visit, especially for those new advisors there. Some resources. We've got a lot of awards, deadline dates, things for you to kind of think about through the semester. But if you kind of think of when Chapter Achievement Awards and when your Patient Care Project Awards, you can kind of build your schedule and agenda from there. As I mentioned earlier, your chapter president-elect is that person who you want to keep the records throughout the year, so when you have to complete your award report, which is due July 15th, that they're ready to go during that time frame. So reporting cycles are June 1st through May 31st annually, and those reports are due July 15th for the Chapter Achievement Awards, as well as our patient care projects. And for patient care projects, it's going to be our new OTC literacy program, Operation Diabetes, Operation Immunization, and Operation Heart. Generation RX is a little bit different. That is actually due on January 5th. We use the calendar cycle for that. And the reason why is we want to send the top 3 winning schools to the APhA Institute on Alcoholism and Drug Dependencies later on that year. If we did it the other way, there would be a little bit of a delay there, and that's one of those benefits of that. For your international vice presidents, it's important that you know that that report is due a little bit earlier. That's due June 1st annually. It's still that June 1st through May 31st, but what we want is we want to take the information from the APhA-ASP Outstanding Activity Report, and we want to combine our report and use it for our World Congress. Right now, World Congress just ended. It was over in India this year. We've got some phenomenal reports coming from our APhA-ASP national officers, but if we don't have the data to share with the world, then it kind of makes it pointless to hand that in by July 15th there. Individual awards, those are due for TICE, our Dean, our Advisor, our Student Leadership Awards, as well as our Good Government Student Pharmacist of the Year. Those are due November 1st. And for the TICE, the Dean, Chapter Advisor, there's 4 Student Leadership Awards, as well as 1 Good Government Student Pharmacist. Each chapter can only submit 1 application for those. But there's a lot of great students out there, and we want to make sure that they're recognized. So we'd love, love, love to have you submit those award reports. Our FarmFlix t-shirt design contest, those are due December 1st, as well as our standing committee member applications are also due December 1st. It's important as you're juggling all of these dates and deadlines and these time frames that you do allow and you do tell your student pharmacists to let you know early enough. We've got a lot of chapter advisors who are seasoned advisors who, for the July 15th deadline for chapter achievement reports, they actually have to have their entire report in by June 15th. So that gives that advisor a month with vacations and end of the semester activities to really go through and look through that, because each one of these reports and each one of these applications for regional office, national office, they all require your signature and your review. So make sure that you set those deadlines early enough so you're not stuck at midnight the day before it's due. MRMs are coming up. This is one of those activities that we encourage those finance vice presidents to reach out and kind of see what the travel schedule looks like. But regions 2 and 3 are going to be October 16th through the 18th. November 30th through November 1st is going to be a fun weekend for APhA staff, because we've got regions 4, 5, 6, 7, and 8 all in the same weekend. And then we're going to round it out for November 6th through the 8th up in New England, up by Plymouth, Massachusetts there. Registration has opened for MRMs. As of 2 days ago, we already had 68 students registered for it. And I will let you know, last year, Region 4, Region 3, Region 6, and I believe it was getting close to Region 2. Those all sold out about a month before the meeting. Unfortunately, we are space limited based upon the size of our ballroom, and we have tried as best as we can to get space that's large enough, but demand has been going up, up, up each year for these mid-year regional meetings. So please, please, please get your students signed up for membership and then have them register for MRMs right away. The official deadline is 14 days before, but I really wouldn't count on that, especially for that Nashville meeting in Region 3. It's $125 this year for students to go to the MRM, which is a little bit more than it has been in the past. Unfortunately, sponsorship is down, and we need to make sure that we can balance out those food costs as well as room rental and audio-visual costs that we're having at the hotels. And as we get to bigger venues, the costs go up, and unfortunately, we had to increase the rate just a little bit this year. For those chapters that are interested in having students run for mid-year regional meeting coordinator, Lynette and I will be working on that, and locations for MRM 2016 will be released in mid-September, so you guys will know where the MRMs are going to be next year. I mentioned OTC literacy a couple times. This is actually one of those new projects that we're starting this year. It's officially launched at our Summer Leadership Institute, and we've been kind of teasing it since annual meeting. But we built this based upon our 2015.2 APhA-ASP House of Delegates policy that wanted students to go out there and work with patients to not use tablespoons and teaspoons, but to actually use some precise measuring devices. So our focus with this program is not only to work with parents of, say, infants, toddlers, of young students, but to really focus on 5th and 6th graders. About 90% of students who are under the age of 16 have used a OTC product at least once. And we find that 11 or 12-year-old range of age, that's when they're actually self-medicating. So whether it be cough and cold, or it be any of the pain relievers that are out there, we want to make sure that we can teach our students how to read medication labels, how to follow them properly, which medication devices they should use when they're measuring it out, how to store it, and kind of the counseling techniques. So OTC literacy should be a great program. It's actually in place of our Operation Self-Care, so we wanted to make sure that we continue that great benefit for our student members. Our APhA Institute on Alcoholism and Drug Dependencies, we ran our inaugural year, which built off the success of many, many years at the University of Utah School on Alcoholism and Drug Dependencies. So we had our first year this year, and we're going to continue it next year. Now, we got approval for that from our board and our senior management. This year, it'll be June 3rd through the 6th in 2016. We're going to keep registration the same at $325 for student pharmacists. Registration this year will open in January. We do have 2 $1,000 scholarships for students through our foundation, and we're going to open up the ambassador applications a little bit earlier this year too, so kind of stay tuned a little bit for that. This year we kind of raced to get everything done, but it was a phenomenal success, and the students that attended had just a wonderful time. We were able to offer pharmacist CE as well as university credit, and we're going to continue that in the process next year. We do have 275 student spots, 75 for pharmacists and faculty, and 15 for our staff and ambassadors, and that rounded up to about 350, 360 there. We're going to hold strong with our 1 to 2 students per every school and college of pharmacy for that pre-registration deadline, and that'll be in that January-February timeframe. But once that surpasses, we'll then open it up, and as you can see there's 5 or 6 students from the University of Louisiana Monroe. We'd love to have as many students that can come to fill up that 275 number, but each school is guaranteed a spot right off the bat. Another great program and meeting that some of your students may want to attend is the Federal Pharmacy Forum. It's actually going to be this year, October 19th through the 22nd in Washington, D.C. And Monday's programming, there's a big shift this year to actually include student pharmacists. So we're going to have student pharmacist program all that day. So if anyone is interested in federal pharmacy as a career, whether it be in the VA, Public Health Service, Indian Health Service, Army, Navy, or any of our armed forces, we'd love, love, love to have students attend. For more information, visit jfpsinfo.org. We had a lot of students from the D.C. area come last year, but we'd love to see students from a little further out. We are continuing our Pharmacists Provide Care campaign. Hopefully, if you've been a member of APhA for a little while now, this is not new to you, but we are getting very close. As of a couple days ago, we had 185 members of the U.S. House of Representatives co-sponsor our bill, and then we had 26 senators, which is phenomenal. And I actually was speaking with our senior lobbyists here at APhA, and because of the results of what we did at the Summer Leadership Institute, we had 12 co-sponsors from the House and 2 senators jump in. So your student pharmacists who were able to visit them during the SLI did really make an impact. But we've got a lot of great state infographics, web banner ads that you can add to your website. We've got those comment cards there, and then also we're going to update our policy postcard challenge. So it's actually going to look like the Pharmacist Pride Care campaign, which you've got your information there. So stay tuned for those a little bit. Just quick plug for our social media. Social media has been growing, and our Education Standing Committee as well as our Communication Standing Committee have really been utilizing Facebook as the method to kind of get our message out there. So as your new members come back to school, as well as your existing members, have them sign up for Facebook and like our page on there. There's a lot of great information, a lot of great tools that are really spread via social media. And then we do have an Instagram account there. Here's our contact information for both LaToya and myself, where's our email address as well as our telephone numbers. We'd love, love, love to answer any questions for you guys. I do see a couple that have come up here. Dr. Jarvie asked, when are the slides going to be made available? Early next week. What we're doing is we're recording all of the webinars. We need to process that, put them up on the APhA-ASP YouTube page as well as pharmacist.com, and then those will be available via YouTube there. And then we're going to be building a Dropbox that's going to have all of the slide decks in PDF format. So those should be available early next week. But we want to take care of all of the webinars from Webinar Week first. All right, we've got just a couple minutes here before we end. If anyone has any questions, use the raise hand function, which is in your right-hand toolbar there. We'll unmute you so you can ask your question live, or if you'd like to type it in, you can definitely do that as well. Well, it doesn't look like we're getting any questions in here. So we had one of the questions that said, unrelated to advising, can this PowerPoint template be made available to our chapter, Kim? Absolutely. You can definitely use the slide deck. We are in the process right now of putting together 2 student outreach presentations. One of them is for your chapter to use to kind of get a visit from our National Executive Committee member, but we're going to put together a basic chapter student outreach slide deck that's going to be updated with newer slides. It's going to have the look of our APhA Membership Advantage campaign, so you guys can use that as well. That'll be available hopefully within the next week here. We can put that in that Dropbox as well for you. So you're welcome, Kim. All right. So I think, so we've got another question here coming from Eric Jarvie. He says, do you recommend co-advisors having admin privileges? So, Dr. Jarvie here. We do, actually. Through APhA this year, we just got a new database within the past year and a half. And at first, we wanted to just make sure that all the information was kind of locked down. And we only allowed the primary chapter advisor to have the login and password to get in and access the back end of the database. So everything that LaToya talked about earlier in regards to updating your chapter members, updating your chapter dues information, running rosters, that sort of thing, that only went through the chapter advisor. But we actually responded back to your feedback, and we want to make sure it's available for you. So APhA actually created a general login and a general password for each individual chapter. And that was sent out to chapter advisors in the spring. So if you don't have that, we can contact LaToya. And so you'll be able to share that login and password. And I wouldn't recommend with a lot of people. I highly recommend it just be your membership vice president and your chapter president, as well as your co-advisors, so that they have that. So all of the, all the information doesn't just rest on the chapter advisor there. So hopefully that helps out Dr. Jarvie. Another question from Rachel Allen is, how common is now co-advisors versus single advisor? It's very, very common. A significant number of our chapters have 2 or 3 advisors, and I would highly, highly, highly advise that you have 2 people running your chapter as an advisor. One would be your primary person to focus on, say, membership, administrative things, taxes, finances, communicating with your administration, and a lot of other chapters have that guru who knows what to do when it comes to patient care and can kind of work out with the community. So there's a lot to be done for chapter advisors, and I'd recommend that you have as many as you can. Absolutely, if you want, have a new practitioner mentor too. They can fill in some of those gaps that maybe having a couple advisors aren't able to do, but definitely co-advisors is the way to go. Unfortunately, we don't provide a comp membership to the co-advisor. It's only to the primary advisor, but we've got a lot of chapters that kind of go back and forth every other year and share it. And for those chapters that do an extremely great job for membership, if you achieve a certain level of membership, 80% or higher, we do provide a comp annual meeting registration, which is $500, $600 value there. So we do kind of balance that out, and a lot of times the co-advisor does get that. So definitely get yourself a co-advisor. It's smart to do that. So for a lot of the new advisors, just kind of throw one pitch out here. I know we're a minute over, but I do like to spend about half an hour or so talking with new advisors that are new to their position. And I've got kind of my set pitch that I do. It's not really anything I can kind of send out because we kind of do go back and forth from dialogue, but I talk about understanding the role of the advisor, advocating for students to your department chair or dean, being a mentor, how to kind of separate yourself, additional support, finding other practice faculty to help you out. We go over taxes. We talk about state associations, residents, preceptors, as well as liability insurance, and then kind of go through the nuts and bolts of APhA-ASP. So if you are a new advisor and you're interested in that, contact me, and I'd love to get you set up there to kind of talk over the phone. So with that, thank you so much for attending. I do apologize for some of the tech issues that we had earlier. Hopefully this was something beneficial for you, and we'd love to hear from you in the future and see you out on Outreach and MRMs. Everybody have a great afternoon.